you so much for joining us on our segment today all about breast. I'm Dr. Branch, and this is my nurse, Lauren.
All right, so we are going to start with talking about breast augmentation for some of our people who want larger breasts. What are some options for them?
So the most popular thing, obviously, is implants. And because it's so popular, because it's so easy, it is a quick recovery, and you get a lot of decision over the size and the look that you want.
So you could be natural or augmented per se.
Yeah, so the size, we really cater it to your frame, your width, how much skin or tissue you have. But you really can get a lift out of it at the same time and just fill you out up top and still look very natural, or you can go with the more augmented look, or go very small. It's really all up to you.
Okay, so what about the different types of implants?
So the most popular type is still silicone. You know, the saline implants are more of just a water balloon. Now the silicone implants have a lot different consistencies, gumminess, feel to it, so they help shape the breast a lot better, so they become a lot more popular, and they're still just as safe as the saline. It is just something you just want to maintain.
So one of our most popular questions is, how long is the recovery process, and how long do people need to take off work?
So this is actually one of the easier surgeries we do. It can be, the surgery itself, 45 minutes to an hour. You're only here for a few hours, and 2 days, you're pretty tight and sore, but after that, people really bounce back very quickly. And so most people, a week off of work, or if you're working from home, you may only need a few days. So as far as recovery, it's very quick. As far as getting it done before summer, this is a great time to get it done and be ready kind of for your swimsuit beach body. If you have any questions, please give us a call. We'd be happy to see you. Coming up next, we're going to be talking about breast reduction.
So we'd like to talk about breast reductions today, possibly a lift as well.
So yeah, a lot of women come in not wanting larger breasts, but smaller, because they've genetically just have much larger breasts, and they're heavy, or they have strain, they kind of on their shoulders. It's hard to find bras. So this is a very popular surgery, and people are very happy when they have this done, because it's combined with the lift. So in addition to kind of taking out as much breast tissue that you want to kind of get to the size, whether it be a C or D, you can kind of cater it to what you want. You get a lift at the same time. So a lot of women, you feel much better as far as being able to find bras, clothes fit better, your back pain, all relieved with this surgery.
So for some of our patients who have not had children yet and have questions about breastfeeding after a breast reduction, what would you tell them?
So a lot of women are coming in very young because they have this problem, and especially being young, it's a burden on them, and knowing over time it's just going to get worse, their back pain gets worse. They just go ahead and make the decision to do it before children, knowing that you may or may not be able to breastfeed. You may be able to breastfeed some, but supplement with formula and things like that. So some girls think it's worth that trade-off to do it up front, versus there's another kind of spectrum. They come in their 40s and 50s after kids and they're old enough, then we can do it then as well.
So there's multiple options for all different age groups. All right, so what about the recovery time for a breast reduction or a mastopexy? What's that looking like?
So it may be a little longer than your breast augment, maybe 1 to 2 weeks, depending on your job. If you're at a desk, you're not lifting a lot, then you usually at the average is 2 weeks. It's just a lot more incisions and scars to heal, but a lot of these scars do fade very well. A lot of people are scared of having more scars, but it's definitely worth the trade-off as far as the lift and the shape of the breast, and they do fade very well over time. But most surgeries, we say by 6 weeks, you're feeling pretty much back to normal.
So what are the other questions our patients have with breast reductions and mastopexy? The scars. They're worried if you could see it in their bathing suits and what it's going to look like.
So most scars are very well hidden. They do kind of go around the border of the nipple, so it kind of hides there. The only one that's a little more obvious is the one that kind of goes straight down from the nipple, and then there's one underneath in the bra line. So it's kind of the shape of an anchor.
Okay.
You know, they may be lighter or darker than your natural skin, but it should be a very fine line. Now, if you have a question today, please go ahead and put it in the chat box on the Zoom.
So if you're interested in anything we've talked about today with breast surgery, please give our office a call and meet with myself and Dr. Leslie Branch or any of our board certified plastic surgeons. We'd love to have you.
Hi guys, my name is Quinta Beckwith. I am the cosmetic coordinator here at Forsyth Plastic Surgery. So this month is actually breast month. I love talking about these sorts of things because I'm the one that schedules all of those cosmetic surgeries for this office. So by the time I've seen most of my patients, they have been thinking about their breast surgery for at least like 3 to 5 years for the most part. So by the time they come in, they have made their mind up, they are ready to schedule this surgery, they're ready to go. You know, what I like to tell my patients during our consults is you have to start planning for like this new body. You know what I mean? You have to kind of start getting used to having fuller breasts if you're going to go up in size, or you have to start getting used to smaller breasts and buying clothing, you know, because it's kind of a mentality as well. Your mentality has to change because your body is getting ready to change. So if you've been thinking about it for a while, like some of my patients that I see here, you might want to come on in and give us a call and set up a consult with one of our surgeons.